Hi, good morning, everybody. My name is Dominique Cortoni. I'm from NMG Consultants and Actuaries in Cape Town, and it is my pleasure to introduce Dr. Kylie Montgomery. Dr. Kylie Montgomery has a practice in Waverley and has been involved in corporate wellness presentations and workshops for over 11 years. She has a counseling degree and extensive experience in educational talks, counseling for grief and COVID-19 counseling. Dr. Kylie Montgomery is going to discuss vaccinations, boosters, etc. for all members. She's more than happy to take questions, and you will see that the chat is open for any questions. So should you have any question, please feel free to put it into the chat group. Thank you very much, and welcome, Dr. Kylie.
Thank you so much, Dom. It's lovely to be here with all of you. I'm looking forward to the session. As we said, it is still quite a controversial topic, the vaccine. So that's why I want to keep the chat box open throughout the session. I'm more than happy for you to pop questions throughout. I'll answer as they come up. At the end, I'll also leave some time for questions. So if people want to, ask them verbally, you can unmute yourself and ask at the end. So I just want to open up and share my screen now with everyone. Can everyone see the presentation? Dom, can you just let me know if you can see that?
Yes, we can.
Fantastic. Okay, so before we start talking about the vaccines, I think it's best actually to start with understanding this virus a little, how it's mutated over time, how it's changed, so we understand where we're at now and why the need for the vaccines has arisen. So when COVID first hit our shores in 2020, it was primarily the beta strain. The beta strain tended to affect mainly the elderly, the immune compromised, the sickly, and the weak. We didn't seem to see it affecting children, strong, healthy adults, or fit people either. However, everything changed last year around June, middle of the year. We got the Delta strain. The Delta strain started in India, spread rapidly throughout the world, infecting 85 different countries and becoming the dominant strain in them. From there, it's also moved to other countries and ultimately spread throughout the world. It has been by far the most virulent, most aggressive, and most dangerous strain. It's the strain that was responsible for all our deaths in the third wave. Out of all the waves that we have had, Delta claimed the most number of lives. We saw when Delta hit our shores, now no longer did it just affect the elderly, the weak, and the immune compromised. It actually affected sorry, I just want to open the chat box. It also affected the fit, the healthy, and our children. In fact, one of my closest friends, a big runner just like me, she had COVID, didn't even have it very severely. 2 weeks after recovery, she went for a run and dropped dead of a heart attack, 42 years old. Another really close friend of my partner's, a triathlete, used to do the Ironman. He was in ICU for 7 months. They don't think he'll ever be able to walk without a crutch again, let alone ever compete in a high energy sport like a triathlon again. My own partner, because he couldn't get the vaccines at the same time I could, he wasn't in the age group that was eligible yet, he got COVID, also a triathlete. His lungs were so scarred post-COVID, they looked like a chronic smoker's. They don't think his lungs will ever have the capacity they used to have. They don't think he'll ever be able to compete at the level he used to. So Delta changed the whole picture. In the beginning with Beta, we used to think, you know what, if you're fit and healthy and young, you'll be fine. You actually don't need a vaccine. Delta changed that because it meant sitting here, you don't know how badly it will affect you. Even now, you don't actually know what weaknesses are lying in your body. And that is what's so scary about this virus. It goes in and finds your weak spots. If you have been an athlete and you have exercised while you were sick and caused damage to your heart muscles or valves, you may not even know that. COVID knows that. It goes in, it attacks your heart where it's weak. People who are prone to asthma, bronchitis, it attacks their lungs. People who are diabetic, it attacks the pancreas. People who have kidneys issues, it attacks your kidneys. It's a very intelligent virus. It attacks where you are weak. And while we sit here thinking, oh, I think I feel fine and healthy, COVID knows where your weaknesses lie. You don't know how well you will fare with this virus. So that is why, you know, the vaccine started to come out to protect us, because we didn't have any idea how badly it would affect you. So I'm going to go to the next slide. Now, when it comes to the Delta strain and the Omicron, which is the new one that's come out, transmission, it is much more contagious. Now, with viruses, I want to share with everyone that when you have a virus, it doesn't matter what organism it is. The goal of any living organism is to continue to live. So whenever something is thrown at it to try and kill it off, it will adapt to survive. So for instance, take the malaria mosquito. How often have we had to change the malaria medication because the mosquito has become immune? Look at TB. In South Africa, we have extreme drug-resistant TB. Why? Because TB has become immune, so it is mutated to be able to bypass the medication. Look at flu. So every year we take our flu vaccines. We used to have Influvac 1, Influvac 2, Influvac 3. Now you hear on the radio Influvac 4 for the 4 strains. As the virus, the flu virus mutates, we have to adapt the vaccines in order to keep up with these mutations. So every single living organism will adapt to survive. Even HIV is not the same strain it was that, you know, it began with. So it's not that this is a sinister thing, that it's mutating, you know, at an unusual rate. It is actually normal for any living organism to adapt to survive. So what happens with this virus is it actually, the more it mutates, it seems to be getting more contagious, but less deadly. So a virus, in order for it to be what we call a highly evolved virus, it shouldn't actually kill off its host, because if it kills its host, it prevents transmission. So Ebola, even though it has a 96 to 98% death rate, it's actually not an evolved virus, because what it does, and we've seen, you all know, Ebola, there'll be an outbreak, it will kill off the whole village, and then it will disappear, because there are no longer any hosts to keep it spreading, so it dies. So that is a like non-evolved virus. This virus is a very evolved virus. It's mutating, it's becoming more contagious, but the good news is it seems to be becoming less severe. However, the new studies are showing that part of that like reduction in severity is because so many people have been vaccinated, and so many people have got natural immunity from being exposed to COVID naturally. So actually, it's also becoming less severe because of natural and vaccination immunity. So we are getting to the point where we can start living with this virus, just like we live with flu, okay? One thing I do want to make very clear, because people always say, why should I take the vaccine if natural immunity gives me more protection? So in an adult, natural immunity actually is stronger than vaccine immunity. However, in a child, vaccine immunity is stronger than natural immunity. The problem also with natural immunity, firstly, you only have protection against the strain you had. So if you had the beta strain, you have protection from the beta strain, not the delta strain. If you had the delta strain, you have protection from delta, not from Omicron. So depending on what strain you had, you only have protection from that strain, not the others. Whereas the vaccine gives you a form of protection from all the strains. There was also a case of a well-known international star who decided that they didn't want to have the vaccine, but they were allowed to fly internationally if they had a vaccine like not a vaccine certificate, but a COVID certificate that they had COVID in the last 6 months. So they actively went out and got themselves infected. They hung around with people who had COVID so they could catch COVID, and she actually died from it. So I really don't advocate that line of action, okay? If you want to travel, rather you have the vaccine, then you go and get yourself infected. As I said, you don't know where your weaknesses are in your body. You may think you're 100% healthy, but there's a weakness that the virus will like latch onto and attack. So please don't think that's the way to do it, okay? And for our children too, they will get more immunity from the vaccine than from natural immunity. Now, as I said, new variants are popping up. The more a virus spreads, the more it is going to mutate to make it like more contagious. We've seen various different ones. We've had Lambda, C1, 2, MU, Delta plus Omicron. Now we've got the Deltacron, which is like a mix of Delta and Omicron. So they are going to mutate. Even flu mutates. It's not an abnormal thing. It's not, you know, only significant in this virus. The flu does it as well. One of the things I want to stress, and one of the reasons that Delta spreads so rapidly, is we missed the symptoms. Everyone was still looking for the high fever and the cough that came with the beta strain. However, Delta tended to arise looking more like allergies or hay fever. So a lot of people actually had almost like a sinus headache, also going into the back of the neck and back pain. They also tended to have a lot of sneezing and a runny nose. So there was a case of a woman I know who thought she had sinus because she always gets allergies at the change of season. So she was sneezing a lot, went into the office and infected 48 other people. So please, being aware of your symptoms is very, you know, important. Please make sure that you are aware of it. With children also, with the beta strain, very rarely did we find children testing positive. Very rarely did it affect children. However, with the beta strain and the Omicron strain, it appears more like a tummy bug. So they tend to have diarrhea, nausea, vomiting. So if your child comes home from school with those symptoms, please can you just check that, you know, it is flu or a tummy bug and not COVID, okay? I'm just going to check. I see some questions are coming in. I will be touching on the side effects. Tim, I'm actually going to go through the side effects, both the like non-damaging, what we call the vanilla side effects, and the toxic side effects. So we will get there. Yes, definitely, Dom. I'm going to also talk about when you vaccinate too soon after having COVID. And then when will children younger than 12 be allowed to get the vaccine? So in other countries, children under 12, between 5 and 12 are already getting the vaccine. And in the US and the UK, they're already advocating for children 6 months to 5 years to get the vaccine. I don't know when South Africa is going to like put it into place. All over the world, children under 12 are getting it, and a lot of the medical professionals are pushing for children between 5 and 12 to get it, because at the moment they do tend to be the highest number of cases. So we are hoping that they get it soon. I'm also going to talk about the boosters. When we talk about the boosters, I will discuss whether we should get it, whether you shouldn't, okay? So I'm actually going to go through the questions now so that we can actually talk about it. Okay, so with the boosters, this is what happens when you, if you guys don't mind, I'm going to just talk about how the vaccines work. Then we can understand how the boosters work. So I want to go there first and then go through the questions, okay? Now, before we get to the vaccines, there's something we are going into flu season now. We are also COVID is going to probably rear its head again. So we need to be aware of, if we do get COVID and we are recovering at home, what you need to be careful of. Your body gives you warning signs that it is in crisis mode, and you can't ignore these warning signs. Sadly, what we found is a lot of people didn't get to hospital quick enough because they were worried that people going to hospital and die. And sadly, that was the case because they left it too late. So it's almost like cancer. If we catch cancer early, your chance of survival is much better. The later you catch cancer, the worse your prognosis. Same with COVID. By the time people were getting to the hospitals, they were already in organ failure because their organs had already suffocated from loss of oxygen. So if you do have COVID, you're recovering from home, these are the warning signs that you need to take heed of, telling you need to get to hospital. So normally, when we breathe about 12 breaths a minute. If you are now breathing like this, so 24 breaths a minute or more, it means that your lungs are going into panic mode. They are realizing there's not enough oxygen in the body. They're starting to hyperventilate to try and compensate for that. This is a warning sign. Your organs are starting to suffocate. You get to hospital and you get on oxygen. The other warning sign, our pulse rate or our heart rate is usually about 72 beats a minute. If you're very fit, it may be closer to 60 beats a minute. But if we are now at 105 beats a minute or more at rest, it means that your heart is starting to realize there's not enough oxygen. It's starting to panic. So it's starting to pump more rapidly to try and get blood around to compensate for the lack of oxygen. Please, you have this, you get to hospital, okay? Two other things have also made a significant difference in the recovery of people who have COVID. One of them being catching the warning signs early. So what we've noticed is on day 6, people's bodies start to produce certain blood markers. Those blood markers are inflammation markers and clotting markers. If these are high, you are more at risk for hospitalization and death. So I always say to my patients, please on day 6, go and get your bloods drawn. If your inflammation markers are high, we'll give you cortisone to bring them down. If your clotting markers are high, we'll give you blood thinners to bring those down, because those are the things that end you up in hospital. We catch it early, we treat it early, we have a better chance of survival. That does not mean, however, that you go and take cortisone too early. Cortisone weakens your immune response. You take it when you don't need to, it's a problem. You take it when you do, it saves lives. And last but not least, the amount of water you drink when you are sick with COVID has made a big difference on how well people recover and their long COVID symptoms. So think of inflammation in the body like wildfire. When it's raging through your body, it damages organs, it causes scarring. If we put water onto it, it cools down that inflammation, it stops it, okay? So drinking 3 to 4 liters of water a day when you have COVID helps with the inflammatory process. Also, when your blood is nice and thin, it prevents it from getting sticky and thick and forming clots. And clots are often the reason for the deaths in COVID. So if we keep our blood nice and thin with lots of water, it will prevent that clotting and save lives. So those are the things I want you to be aware of if you do get COVID and you are recovering at home. Another thing to be aware of, and the medical community have been very worried about, is the impact of a super flu. For 2 years, we have hidden from the flu. No one has been getting flu, and now we're seeing people getting very sick with flu. Please do not take flu like lackadaisically. It is also a huge killer. In 2019, we had 26,000 deaths in South Africa in 3 months from flu alone, okay? It is a killer, especially to the immune compromised in our children. Don't take it not seriously. Please, we are going to see a very strong flu this season. Go and get your vaccines for flu as well. They are different viruses. You need to get your flu vaccine. They are currently working on a vaccine that will be a combination between flu and COVID. We're not there yet, but until we get there, please take your flu vaccine. Now, getting to the vaccines. In South Africa, we have 2 types of vaccines. We've got the Pfizer and the Johnson & Johnson, as you know. Both of them are fantastic vaccines, and they were chosen because they were the best vaccines for the strains in our country. So people wanted to know, how did they choose which vaccines we get? Very simple. Different genetics are more prone to different strains. So the UK and the US were more prone to the alpha strain, which responded very well to the Moderna vaccine. South Africa, we were more prone to the Delta and the Beta strains, which responded better to the Johnson & Johnson and Pfizer vaccine. When the Delta strain hit the UK and the US, they started using the Pfizer vaccine. So it's not like we were just given any vaccine without any thought. That is why we were given those vaccines, okay? Now, both the vaccines, actually all the vaccines, have the same goal. They want to teach your body to respond quicker when it sees COVID. So normally when we are exposed to COVID, it takes about 3 to 4 days for our body to launch an immune response. However, because this virus was so aggressive, in 3 to 4 days, it could take a strong hold in your body, reproduce rapidly, pushing up your viral load. Now, when we had the vaccine, what happens is it teaches your body to respond within a day, preventing the virus from taking such a strong hold in your body, preventing it from reproducing so rapidly, and keeping your viral load low. So that's why a lot of companies are encouraging staff to be vaccinated, because even though a vaccinated person can still get COVID, their viral load never gets that high. Therefore, they are 67% less likely to infect someone else than an unvaccinated person. So they become less contagious even when they have COVID. So a bit like HIV, if you have HIV and you are taking your ARVs, you're keeping your viral load low. Even if you had unprotected sex, the chance of you infecting someone else is lower. However, if you're not taking ARVs, your viral load is high. The chance of you infecting someone else is much higher. It's the same with this vaccine, okay, and this virus. So the Pfizer vaccine is what we call an mRNA vaccine. And this is where people started to think that it changes your DNA. They hear the word, mRNA, and they think it changes your DNA. That isn't the case at all. mRNA simply stands for messenger RNA. So it's a strand of RNA that delivers a message to your immune cells, teaching them to respond quicker when it sees COVID. As soon as it's delivered its message, it breaks down into its component parts and dissolves in the body with no permanent changes except to teach your body to respond quicker to COVID. Now, the Johnson & Johnson vaccine, same goal, but slightly different process. Instead of using a strand of messenger RNA, it uses a strand of harmless virus to deliver the message to your immune cells. As soon as that has delivered its message, it also breaks up in your body and dissolves. Now, people think because they hear, oh, it's a strand of virus that gives you, the message, they think we inject you with COVID. We never inject you, not even with one molecule of COVID. We inject you with something that mimics COVID, looks like COVID, acts like COVID, makes your body respond like COVID, but it isn't COVID. Sort of like sweetener. Looks like sugar, tastes like sugar, it isn't sugar, okay? So we give you a harmless virus, which is actually an adenovirus, to deliver that message. So think of it like this. If you ordered clothing from overseas, one place sends it by air, one sends it by ship. As soon as you've unpacked your clothing, you throw away the packaging, you still have the clothing. That's sort of how it works, okay? So that is how the two vaccines work. Now, understand, when you have the vaccine, most people get immunity from the vaccine about 6 to 8 months, okay? If we test your blood, we will find that after 6 to 8 months, you no longer have antibodies. That is why we needed the boosters. Now, the flu vaccine, just to put this into perspective, when we have our flu vaccine every year, the flu vaccine also only gives you protection from flu for about 6 to 8 months. After that, you're no longer protected from flu. However, flu is a seasonal virus. We only get flu in winter. If flu was a year-long virus, we would probably have to take a booster halfway through the year. So that's the same with COVID. Because it's a year-long virus, we are probably going to need boosters every 6 to 8 months to up your antibodies again, because after 6 to 8 months, you don't have protection anymore. So that's why we need those like boosters. Now, when we have vaccines, every single vaccine or medication that comes onto the market has to undergo clinical trials, okay? Now, clinical trials work like this. You have a group of like volunteers who take part in the trial. Then when we see no adverse effects, we roll it out to a bigger group, and a bigger group. As we go along, we look for side effects. Now, side effects are classified into two different groups. There are the vanilla side effects and the toxic side effects. Vanilla side effects are things like headache, aches, nausea, a bit of aches and pains and fever. They pass in 2 to 3 days. No severe reactions, no long-lasting problems. Those are vanilla side effects. Now, occasionally we get toxic side effects. These are effects that could potentially be fatal. So remember with the Johnson & Johnson vaccine, we originally had those issues that maybe it caused clotting. Now, when that happens, they immediately suspend the trial and they see how many cases that toxic side effect occurred in. If it happened in only a minuscule amount of people, they will still deem the medication or the vaccine safe for the general population. So in the case of the vaccine, the Johnson & Johnson vaccine, they found that it was only a 1 in a million chance you would get a fatal blood clot from the vaccine. So let me put this in perspective. Any of the women listening here today who take birth control tablets, do you know you have a 5 in 10,000 chance of having a fatal blood clot from your birth control tablets? And if you fly in an airplane, that risk increases to 12 in 10,000, meaning you are 10 times more likely to get a fatal blood clot from your birth control tablet you take every day than from the vaccine. Every single medication we take has a potential to harm us. And when it goes, it's finally put onto market, it has to be that the side effects are in such a few amounts of cases that it's still safe for everyone. However, there may still be cases where you are the person it's not safe for. So go home tonight. I want every single one of you to go to your medicine cabinet, look at the medicine you take on a regular basis, whether it is your antidepressants, your Miprodol, your Grandpa, your sleeping tablets, anything you take on a regular basis. Look at the side effects listed on the package insert. If a side effect is listed there, it means that in the clinical trials, someone had that side effect. And you'll be shocked to read those side effects range from brain damage, seizures, blindness, loss of taste, numbness in the hands and feet, gastrointestinal bleeding, ulcers, and in some cases they even list death. Okay, so everything we take on a daily basis and things that are normal, antipsychotic drugs, antidepressant drugs, painkillers, all have a potential for very severe side effects. So this vaccine is not, unusual that occasionally people have side effects. Everything we take, even nuts. I'm deathly allergic to nuts. If I eat them and I don't get an EpiPen in me immediately, I end up in hospital. My best friend can eat packets of the things. She's fine. Does that mean nuts are bad? No, it just means my system doesn't handle them. So that brings me to the side effects that you can get, okay? So the vanilla side effects, if you go and get your vaccine, these are things that you may experience. These are things you don't need to worry about, okay? So in the arm where you got the shot, there may be pain. And people are different. Some people get side effects with the first vaccine and not the second. Some get it with the second and not the first. Some people don't get with either and only get on the booster. So people are different. So the pain in your arm may feel like you were punched in your arm. It may be hard to lift your arm, lie on it. It passes in about 2 to 3 days. You may also have redness and swelling. We stabbed you in the arm with the needle. Of course, you're going to have some redness and swelling, just like if a bee stung you. Put some ice on it. It helps with the redness, the swelling, and the pain. You may also feel tired. Now, I told you earlier that when we vaccinate you, your body starts to launch an immune response. That immune response requires energy, so it steals energy from the rest of your body. That means that in the week after having your vaccine, your body is vulnerable. You have to think of yourself as a newborn baby with no defenses. In that week, your body is forming an immune response. So in that week after having the vaccine, I would like people to try and limit your social interaction, especially in places where you don't have masks on, like restaurants or dinner parties. Because if any of your friends or family have got flu, a tummy bug, or COVID, you are going to catch it because you are vulnerable in that time. While your body is building its immune system, it is weak, okay? Now, you also need to make sure in that week after the vaccine, you stay away from hardcore painkillers like cortisone, mipridol, and like anti-inflammatories. They will weaken your immune response, making the vaccine less effective. Same thing with alcohol. I know we're South African, we love our alcohol, but in the week after the vaccine, please try and limit your alcohol. Don't have alcohol for a week, not because it will make you sick, but just because it will weaken the response of your immune system and make the vaccine a little less effective. And then with exercise, 2 days after the vaccine, please no exercise. And for the 5 days after that, only exercise at 70% of your max. So there were cases where people said children who had the vaccine got myocarditis after having the vaccine. Now that's inflammation of the heart muscle. In every case where children had that, we found out they did sport in the 2 days after the vaccine. Your body is compromised. It's like exercising. When you are sick, it's going to hurt your heart muscle. Please rest. Now, because your body takes a bit of a knock while you are building this immune response, there are certain groups of people in my practice I will not send for the vaccine. That is because their systems are already too weak and compromised. The vaccine may be too harsh for them. So the groups of people I do not want getting vaccinated, even though I'd like to protect them from COVID, unfortunately, the risk is too high. And these are the people, when we hear of cases, people had the vaccine and got very sick or ended up in hospital. Most of the time, it's people with these issues. So anyone in organ failure. So whether it is kidney failure, liver failure, lung failure, no vaccine for you, okay? My mother is in heart failure. Unfortunately, I can't send her for a vaccine. I just don't think her heart can handle it, okay? Unmanaged chronic illness. So if you have blood pressure, cholesterol, diabetes, HIV, you can definitely have the vaccine. However, only if your chronic illness is well managed. If your chronic illness, your blood pressure is all over the place, it's not stable, until it is stable, no vaccine for you. If you are diabetic, your sugar levels are all over the place, until you get them stable, no vaccine for you. Because when you give a diabetic the vaccine, your body thinks you're sick, which can make it harder for you to balance your sugar levels. If they are already out of control, we can send you into a sugar crisis. So until your diabetes is under control, no vaccine for you. If you are HIV positive, you are taking ARVs and you are under well control on your ARVs, your viral load is low, your CD4 count is fine, then please take the vaccine, okay? If you are not on ARVs or if your viral load is high, no vaccine for you, not until it's under control. If you are ill at the time, so it doesn't matter whether it's COVID, flu, a tummy bug, or even a sinus attack. If you are under the weather when you are due for your vaccine, and this goes for the flu vaccine too, please don't take the vaccine till you are better. It will make you much, much worse, okay? If you are undergoing cancer treatments, so if you are undergoing radiation, chemotherapy, please, you can't have the vaccine, your system is too weak. If you are a cancer survivor, like I am, I'm a cancer survivor, I've been in remission for many years. If you've been in remission for more than 6 months, then yes, you can have the vaccine. If you are actively undergoing treatment, no. And then for Dom's question, if you have COVID. So if you had COVID and you had it mildly, you need to wait a month before you have the vaccine. If you had COVID and you had it severely, so you had oxygen nebulized or you were hospitalized, you need to wait at least 3 months before you have the vaccine. If you have had COVID and after 3 months you still have long COVID symptoms, so you are still battling with shortness of breath or coughing, anything that's affecting your chest, you then need to wait 6 months. So as we said, if you have the vaccine too soon, it can make your symptoms much worse and can bring on long COVID. So you need to wait 1 month if it was mild, 3 months if it was severe, 6 months if you've got long COVID symptoms, okay? So those are the people I don't want getting vaccinated. But going back to, you know, the possible side effects, the vanilla ones, you may have a headache and muscle pain. It's from the inflammation. Drink some water. It will help with that. You may also have chills, fever, nausea. They tend to pass within about 2 to 3 days. Don't worry about it. None of these are things you need to rush off to the doctor and worry about. They will pass. These side effects, however, are the ones you do need to worry about. These are toxic side effects. Very few people get these, but just in case you are one of them, I want you to be aware of it. So when you have the vaccine, they keep you there for about 10 to 15 minutes to monitor for an allergic reaction. However, some people get a delayed allergic reaction. So with nuts, I sometimes can get it immediately. Sometimes it can be delayed depending on the quantity I had. So you need to know this, not just for the vaccine, but for general life. Later in life, you can develop an allergy to shellfish, avocado, nuts. And if you are aware of the symptoms, you'll catch them early, get to hospital quick. If you don't, and you don't get there quick enough, you can suffocate. So itching in the hands, whenever you have itching in the hands, it's a bad sign, okay? You get, I know with me, once the itching in my hand starts, I've got 5 minutes to get to the hospital or I can't breathe, okay? Itching in the hands, then it often starts to feel like there's itching in your throat, like you want, like it's tickling in your throat. You may get puffy eyes, puffy lips, you may break out in hives. Please, you get to the hospital immediately. We haven't had any cases of allergic reactions to this vaccine, but just in case you are one, this is what you need to be aware of. And then when it comes to the clotting, as I said, only a 1 in a million chance of a clot. However, if that is you, you need to be aware of what a clot looks like when you're getting it in your body. So when you have a clot, depending where the clot is, the symptoms will be different. And please note, you can get a clot from anything. A woman who's been on a long plane flight and is on birth control tablets, or a smoker can get a clot. If you've been not moving for a while because you've been sick and bedridden for a while, you can get a clot. After an operation, you can get a clot. So I always say to people, good to know the symptoms because you could get a clot from anything. So if the clot is in your head, you're going to get a blinding headache, like there's a knife stabbing in your head. If it's like in your eyes, you may get blurred vision or a loss of vision. If it's in your neck or shoulders, you may get tingling or numbness of your hands. If it is in your stomach, you may get vomiting or extreme pain. You may get shortness of breath, then it's in your lungs. If it's in your cough, which is often where it's first found, heat, redness, stiffness, and pain in your cough, okay? So if you've been flying and you feel like one cough is swelling or it's very stiff, please be very careful. That could be a clot. So as I said, these side effects, nothing to worry about. The others are things you need to be careful of. So those are the things. Now that I've discussed everything in detail, I want to now go through some of your questions. I'll answer the ones that we haven't discussed in the presentation, okay? So Tim, I hope touching on the side effects helped a bit so you can understand them now a bit more. If there's any that you feel I haven't touched on that you still want to ask about, just pop it in the question. And then Tom, we answered yours, we've answered that. Okay, so the booster, as I said, you just need to Even though we're saying, oh, why do we need boosters? The flu vaccine would also need a booster if it was a year-long virus. But the booster is just because after 6 to 8 months, your antibodies and your protection from the vaccine wears out. And that is actually something that should give people peace of mind. Anyone who thinks that the vaccine causes like long-term changes in your body, the very fact that you no longer have protection after 6 to 8 months means it's not a long-lasting effect, okay? What is the difference between flu and COVID? So Thomas, they're completely different viruses, okay? The flu is from the influenza virus. COVID is from, you know, the COVID-19 virus. They both are part of the, the coronavirus family. However, the symptoms are different. And normally with flu, the symptoms are body aches, headaches, chest, and COVID can present like that. So sometimes the symptoms is very difficult to tell which is which. But you'd obviously have to do a test for COVID to distinguish whether it was flu or COVID, but they are caused by different viruses, okay? That is the main difference. How long will you still test positive after you've been affected or tested positive? So usually from the very first day you are positive, you will stop testing positive about 7 to 8 days later, okay? Some people longer, so people with autoimmune diseases tend to test positive for longer. So I actually had a friend of mine, his mother-in-law, tested positive for 3 months after having COVID. We tested her every single week. She kept testing positive. So it was because her body just actually couldn't rid itself of all the virus particles. She was no longer infectious to others. So after like a few days, you aren't infectious to others, almost like chicken pox. You may still have the spots, but you're not infectious to others. Same with COVID. So even though she was testing positive, she wasn't infectious to others. But normally most people stop testing positive after 7 to 8 days, okay? So Dom, sometimes with the booster, I sometimes think people took the booster too soon. It's like their bodies are just a bit weakened still from the others. I would say to people, after you've had your first 2, I would wait at least 6 to 8 months before the booster, because a lot of people, we've noticed with the stress levels, with the immune compromise that condition a lot of us are in, the booster, then that third one, it's just a bit too much for our bodies. So, and because there's still antibodies in our body from the previous ones, it may be too soon. So I advocate 6 to 8 months, and then people don't tend to get as many symptoms from it. When does death and heart disease become a factor after vaccination? So as I said, I explained that to you, which people are at high risk. So if you've got blood pressure, cholesterol, it's well managed, definitely you can have the vaccine. If you don't, until you get it under control, no vaccines, okay? Otherwise, your heart may not be able to handle it, okay? Yeah, so that, as we were saying, with the booster, some people just got the booster was a little bit much for them, especially if like you had it quite soon after the first 2. So, and you know, being sick for 2 days sometimes does happen after the booster, but it's probably just because your system was a little bit run down at the time, okay? Is there a specific, oh no, Shannon, you can actually have the COVID shot and the flu together if you want. However, I would say wait at least 10 days between the 2, because as I said, it weakens your system a little when you have it. So to give it a double whammy of 2 vaccines too soon together, I would rather say, you know, give it at least 10 days to 2 weeks, okay, just to make sure. If you had a rash when you had COVID, will this happen again when you get the booster? Yes, it probably would. And I would actually, if you had the rash, I would say don't have the booster, okay? Unfortunately, a rash means that your autoimmune system is responding quite badly to the vaccine. In my practice, if people have a rash, it's a warning sign to me. I won't give it to them again. So I would say rather don't have the booster. If you do want to have the booster, you need to wait at least 8 months, okay? So how does the vaccine impact someone with blood clots? Not at all. As long as you're on treatment, speak to your doctor though before you go for the vaccine. As I said, it's a very small chance, even with people who you know, are at risk for blood clots. I would, however, say if you are prone to them, have the Pfizer, not the Johnson & Johnson. The Pfizer has got absolutely no implications with blood clotting. Johnson & Johnson, as I said, 1 in a million, but Pfizer, none. So I would just say then do the Pfizer vaccine. How soon should you have a COVID antibody test after being sick? So it takes about 7 to 10 days to form antibodies after being sick. So wait about 10 days, then you'll see if you've got antibodies, okay? Okay, so this is a very good question, and Tim, I'm glad you asked it because it brings me to one of the fears about the vaccine. So one of the things that people were worried about with the vaccine was, does it cause infertility? And the reason people started to think this, and I totally understand where it came from. When you have the vaccine, remember I told you that in that week, your body feels as though you're sick. Now, often with women, particularly like women who've got more sensitive hormones, when you are sick, you're run down, you're stressed, or you lose weight, it can alter your menstrual cycle for a bit, and then it will settle back down to normal. Same with the vaccine. If you were close to your cycle when you had the vaccine, your body may think you're sick and it may change your cycle. You may get a darker colored period, it may be lighter, it may be, you may miss a period, but then it settles back down to normal after 6 to 8 weeks. It's nothing to worry about, but it was something that people thought, oh gosh, if it's done that, it must be affecting my reproductive system. Not at all. Studies have shown that the vaccine has no impact on the reproductive system at all. However, studies have shown that men who have had COVID, actually for a year after having COVID, have decreased sperm count and decreased sperm motility. So actually having COVID is causing problems. And a lot of women, a high percentage of women actually got scarring on their fallopian tubes after COVID from the inflammation, making it harder for them to fall pregnant. So definitely having the vaccine doesn't cause problems, but having COVID can, okay? So yes, she definitely can have the booster. Just also, you know, make sure before she has a tell her just to take some extra vitamin B. It will help with that, okay? So that it doesn't affect her cycle as much. Okay, so I used to take the flu vaccine really, and they always made me so sick, so I stopped. Now I've got flu, it's almost 2 weeks. As I said, the flu this season is going to be really bad. So I know you are a workaholic, Dom, so I'm telling you now you need to rest, okay? Sleep when you're tired, drink lots of water. A lot of the problem with the flu is going into winter now. Please, guys, you need to drink your water. The one thing that protects your lungs is the mucus lining in your respiratory tract. If you're dry and dehydrated because you're drinking coffee and cup of soup, that lining cracks and allows the viruses to get in. Drink lots of water, definitely helps. Take your immune boosters, do your steaming. A lot of steaming helps a lot, okay? There's also, try this cough syrup. A lot of the cough syrups push the cough deeper. Stodol actually helps loosen it, okay? So try that. Sorry, I've lost where we were. Okay, so that you need to do, but you do need to rest. Sleep is one of the best things to do. Make sure you do that. Lots of vitamin B, zinc, and a lot of vitamin C as well, okay? If someone's got a tendency to clot and has multiple sclerosis and inject immune modulator, you know what? I just think someone who's got lots of different health issues, I would prefer you don't have it, especially with the multiple sclerosis, the immune issues, and the clotting. No, I wouldn't recommend it to that person, okay? I wouldn't take the vaccine booster and the flu vaccine on the same day. No, it's just too harsh for your body, okay? what does one do if they think they're at risk of a blood clotting issue after taking the vaccine? I would just say for a week before the vaccine, take some Disprin, and for a week after, just to counteract any clotting issues that you may have. As I said, also to be aware of those side effects, you know, the headache, the shortness of breath, the pain in the calf. So if you do have it, you can catch it quickly, okay? If someone's had 2 Pfizer jabs, is it better to get a Johnson as a booster? No, I'd just get the Pfizer again. Johnson is quite a harsh vaccine, okay? So to take it as a booster is going to be harsh. I had the Johnson & Johnson and then Pfizer as boosters, but I would say if you've already had 2 jabs with Pfizer, rather don't take the Johnson. It's going to make you a bit sick, okay? It's a harsh vaccine, especially when you've got 2 already in your system, okay? What are the implications of where there are cases where people have been forced to get vaccinated or lose their job and then they suffer toxic side effects or implications? Dom, I'm not quite sure of the legislation on this. There haven't been cases where this has happened that I know of. And unfortunately, with all drug companies, there's no recourse. If like you do react, it's the same with nuts. If I eat nuts and suddenly develop an allergy and die from it, you can't really sue the nut company, okay? If it was an off nut, yes, but if it's just your body didn't react, there's nothing. So when it comes to labor law legislation, that I can't really talk to. After taking the Pfizer vaccine, how important it is to take the 3rd jab. I keep getting text messages that I'm now due for the 3rd jab. So my feeling is with the booster, if it depends on how long, I would say if it's been 8 months after your 2, then maybe I would get it now because we are going into flu season. We do think there'll be a 5th wave. So maybe do it now. If it's before that, then I would say, you know, if you're fit and you're healthy and you're pretty strong, Omicron is a bit mild at the moment. You've had your other 2. I don't think it's as necessary to rush out and get it right now if it's less than 6 months, okay? Is the booster honestly necessary? Chad, that is a very good question. I was discussing it actually with my partner last night because we were both about due for our 3rd one. And the thing is, because we now have Omicron, which is a much milder strain, I feel that it's not as necessary as the first 2. However, I'm watching the space very carefully with the strains. If we get another strong strain coming up, then I would say, yes, we definitely should. And as I said, after 6 to 8 months, you don't have any immunity from the vaccine. So even if you had 2 or 3 or 4 before, the fact is after 6 to 8 months, it's out of your system, so you don't have protection. So it depends on how weak your system is and how immune compromised you are, how strong your lungs are. You know, I would say if it's after 8 months, then yes, maybe you should have the booster simply to protect yourself. Endometriosis, it hasn't got any effect with that at all. There's been a lot of studies focusing on that. It doesn't affect it at all, okay? Does South Africa have a symptom tracker? Unfortunately not. We don't really have that. I do know some doctors are tracking the symptoms of their own patients, but nothing on a countrywide scale. Is there any treatment for the long COVID symptoms? Sadly, we are seeing the scary thing with long COVID, people don't think it's real. It's so real. 35% of people have long COVID for up to 12 months later. And this isn't just like physical symptoms like coughing and tiredness. There's lack of concentration, brain fog, emotional distress, depression, lack of motivation, anxiety, post-traumatic stress from people who've been in hospital. I mean, think about being in hospital, even as a healthcare professional when I was there, and you're seeing dead bodies wheeled past you every 10 minutes, knowing that you're trying to fight off the same virus that killed those people. The emotional impact is severe. So they're saying, you know, the best thing you can do is just like do brain training exercises. If it's like the taste buds and the smell, to try and stimulate your olfactory and your taste buds. to try and, you know, just get more oxygen in, breathe more, do lung exercises, because the more oxygen you can get to the brain, the better it is. Because a lot of the time the brain fog comes from the lungs being scarred and not getting enough oxygen in. So you need to start exercising the lungs again. You need to start exercising. But yeah, it is something that we are really battling with. This long COVID's going to be with us for a long time. Okay. I have a special needs child who's non-verbal. What are your views on vaccines for the special needs people? I do think they can still have it. It hasn't proved to have any issues with, you know, emotional or mental side. So I do think it would be safe for him to have it. I've had 2 jabs at this point. Why were we never told about what you mentioned about the things we need to be? So this is a very good question, unfortunately. If it was up to me, I would say that every single vaccination station should screen people for blood pressure, glucose, cholesterol. They should test, you know, everyone to make sure that they are, you know, well balanced and make you do a better screening. But unfortunately, it's not perfect. And that's why we do these educational talks to help with that, okay? If you've never had symptoms or tested positive but unknowingly had COVID, is there a blood test I can take to see if I've had it? Yes, you definitely can. You can go into a blood test for antibodies, okay? So they can draw blood and then it will tell you if you've got antibodies, okay? Janine, if you started on Johnson & Johnson, I would say have the Pfizer, okay? Because it is nice to mix them, but only if you started with Johnson & Johnson, not the other way around. So that's what I did. J&J, then Pfizer, okay? So booster 6 to 8 months after the second shot, okay? So you have your first shot, then 3 months, well, 42 days later, you have your second shot, and 6 to 8 months after the second shot, you have your booster, okay? So the rash symptoms to some people, like, are more like allergic, okay? So their system, when a lot of kids actually, when they have vaccines, get a rash from it. It's like the body throwing off the toxins, okay? So it's actually the body rejecting the vaccine. So that's why I say when people have a rash, it's their body's rejecting that vaccine. Same as when people like get a rash from shellfish, or they get a rash from eating nuts. It's their body is rejecting that substance. So when, in my practice, when people get rashes, it's the body's way of saying, I'm rejecting this product. It is like violently offensive to me, so to speak. So that's why anyone who gets a rash, I don't like them to get the vaccine again, okay? My eye was swollen after the first vaccine, however, no reaction after the second. Should I be wary of receiving the booster? No, I shouldn't. I'm not sure why your eye would have been swollen. Maybe there was a tiny clot. Amara, just pop in the thing before. Have you ever had a history of clots? Maybe there was a tiny clot there. If that was the case, then I would say maybe be a bit wary of the booster. However, sometimes people got a swollen eye. Maybe you had an infection that wasn't linked with the vaccine. So maybe we just need a bit more info on that. I had my booster 6 months after my second vaccine and had my booster 6 months after my second. Yet with the booster, I was sick. Yeah, some people, you don't also know if maybe you were a bit run down at the time, okay? How long can I wait to have the booster after I had COVID? So I would say same thing as the vaccine. If you had it mildly 1 month, if you had it severely 3 months, if you had it and you have long COVID, then, but long COVID, not the mental health or the brain stuff, the chest stuff, then 6 months. Yes, booster is very safe to take with breastfeeding, and breastfeeding women actually pass the antibodies through their breast milk to the babies. So that's quite cool, okay? Sorry, guys. Yeah, I know there's lots of questions. So missed the question and answer relating to multiple sclerosis. Will I be able to find that? So, Johan, the research has been quite focused on the autoimmune illness side. And they're saying that it seems to be safe for the autoimmune community, and that the autoimmune community should have it. However, I think if you've got multiple sclerosis with other issues, so like with the person I asked earlier, there were other complications with the blood clots as well. So when there's like a whole host of issues, then I would say, you know, maybe think more carefully about it. But if you've got an autoimmune illness, you are in a period of remission and not a flare-up, then I think you should be able to use it, okay? So would it be wrong to take the booster after a year? You could take it after a year, but as I said, your immunity wears off after 6 to 8 months. So I would say maybe push it to 8 months, but not too much more than that. I know someone who had COVID quite badly and battled with his lungs for quite some time. That's my partner. He actually had COVID mildly and battled for months. He's now been diagnosed with lung cancer. No, funny enough, he probably had the lung cancer and didn't realize it, especially if it's stage 4. So stage 4 has been brewing for a long time. It means he had cancer actually probably somewhere else, you know, it's now spread. So it means that the cancer was there long before the COVID. The COVID, he probably got COVID because his system was run down, okay? So no, the lung cancer was its own issue. It was probably there long before, and he probably only found the lung cancer because of the COVID, okay? What if someone has a strong immune system, never really gets sick, only mostly sinus, had COVID where the smell and taste was lost and all the symptoms recovered in 2 days? Does someone like that really need the vaccine? So if you've had COVID, I think you don't need the vaccine for at least 6 months because you will have natural immunity for at least 6 months. However, as I said to you, Clayton, my partner never gets sick. He was an Ironman athlete. When he got COVID, it's the long COVID, it scarred his lungs so badly, he actually, his lung function is 94% as opposed to 99% that it was before COVID. He cannot expand his lungs, he cannot exercise to the capacity he used to, okay? So the thing is, you don't know what damage it will do to your body. My really good friend, the one who died, was an athlete. She was never sick a day in her life and she dropped dead from post-COVID heart attack. So the thing is, the vaccine gives you protection from long COVID, 98% protection from long COVID. And it's the long COVID that's worrying me. The long-term effects, people recover from COVID, but even mild COVID can have the potential to have bad long COVID symptoms. And if I can protect people from that, because we're seeing so many people who are just their quality of life has decreased because of COVID. They're not sick, but they're not well, okay? So that's why, you know, I would advocate it. Long COVID is a fact, but I think I missed what the treatment for this is. So Sharon, it depends on what your symptoms are, but generally most of the symptoms do benefit from trying to get more oxygen into your system. So you need to do lung exercises. A lot of people don't have lung x-rays after COVID, so they don't realize the damage that was actually done to their lungs. So you actually need to realize, imagine your lungs are scarred, you need to stretch them, you need to exercise them, you need to get more oxygen into your body, do more breathing exercises, okay? Were pregnant and breastfeeding moms included in the vaccine trials? Yes, they were. But because not as many breastfeeding and pregnant women want to join a trial, that's why it was only made available to pregnant and breastfeeding women later on, once those trials were finished, once we had sufficient data on it. So what we were going to say is pregnant women, as long as it's over 22 weeks, you are safe to do it. Sure, guys, show me over time now. I'm just going to see, not that I'm aware of, eyesight was okay. But so, by the way, we have found that people after COVID, it's affecting your eyesight. A lot of people are actually having to go and get their lens prescriptions changed because it's affecting eyes. So, yeah, it could have just been a bit of an allergic reaction. So, Amara, I would say wait for 8 months and then go, okay?
Dr. Kylie, thank you. there's a lot of questions that seem to be repeats. So what we'll do is we'll get their specific information from the registration, and then we can answer those questions.
Okay, so do you
if you're comfortable with that?
Yeah, I'm perfectly fine with that. Let me just see if there are any here that we haven't. The thing is, you, Anita, you don't actually know how bad you'll have side effects. Most people don't have them badly, so I don't think you need to really worry. So yes, traditional immune boosters, the stronger your immune system, the better you'll recover. But like I said, my partner takes all the natural immune boosters. I'm very heavy on taking our vitamins and minerals, and he still, had bad side effects, okay? So I think what we must do is, because we still keep getting more questions, and I think we're going well over time, maybe what we can do is have everyone send me their questions. I'm going to put my email here, and then maybe if you feel some of your questions haven't been answered, I'm happy for you to email me, and then I'll reply directly to you. Do you want to do that maybe, Dom?
Whatever works for you. I mean, obviously, it's also your time. So a lot of the questions, as I say, they seem to be
5 more minutes. So let me just.
So there is an interesting question with regard to if you have rheumatoid arthritis and are on chronic and chemo meds, should they take the booster?
No, as I said, if you are on chemotherapy treatment, no.
Okay.
Definitely not.
Okay.
And then with the rash, as I said, if you had a really bad rash, Janine, it means your body is violently rejecting the vaccine. I wouldn't take the vaccine, definitely not. Was that 98% protection from long COVID if vaccinated? Yes. So 98% protection from long COVID. And that actually to me is very important, because when I see everyone's living almost like they are barely existing. They're just existing. No one's got Wummer for life post-COVID. And a lot of it is due to this long COVID, okay? And then in my case, I had a severe flare up in October, November, maybe even a -3. Yeah, I think, Johan, just with you and the vaccine, I think be very careful, as well. Okay.
Would it be suggested, Dr. Kylie, that if people are concerned, also to speak to their GPs directly?
Definitely. And also, guys, I know sometimes, like, let's say you've got parents or you've got family, you're not sure it's safe for them to take the vaccine. Please pop me an email. Say, Doc, this is my history of my mom or my dad or my child. Do you think it's safe for them to take it? Or do you think it's safe for me? I'll let you know if I think you should or you shouldn't. Please just keep my details. I know, we don't always have someone to reach out to, and that's what's more scary than anything, is like, who do you talk to? So please send me keep my email address if you need me, I'm here. So I'm putting it in the chat box again. Dom also has it if anyone needs it. But thank you so much for your interaction. It was lovely being here with you all today. I hope it made you feel a little bit better and you got a sense of security about the vaccines and had some of your questions answered.
So just to let you know, the link will be shared. So as soon as the recording is done, we will be sending the link to you, which will have the chat and obviously Dr. Kylie's presentation available. If you do have any questions or need any further assistance, please let your NMG healthcare consultant know. We're happy to assist. And Dr. Kylie, from your side, thank you very much. I know your time is very valuable, but I know that this is a very close aspect to your heart, and getting that information out to members. I think it was one of the reasons we wanted to do this session, because there is such false information and so many different questions out there. So thank you very much for your time. Much appreciated. And I think we all learned a lot.
My pleasure. And thank you so much for all your questions. Rela Bokhile, I know you asked a lot. I hope we helped a lot with you too. So have a wonderful, wonderful week further. Thanks, guys.
Fantastic. I have put your information available, but as I say, if anyone requires them, please speak to NMG Consultants Healthcare and we will send it through to you with absolute pleasure.
Perfect. Thanks, everyone.
Have a good day. Bye.